Welcome to Capitol Spotlight. I'm your host, Dave Barber, coming to you today from the third floor of the Capitol here in the fabulous building in downtown Providence on Smith Street. And in these segments, we like to visit with members of the General Assembly and discuss some of the issues they've been working on. We have a gentleman with us who is no stranger. He has been here many times. It's good to have back Representative Frank Ferri. Representative Ferri, good to see you again, sir.
Good to see you, Dave, and this is a great building. If the public out there has not been here to see it, please come and visit it. There are tours, and it's a wonderful building.
It's a magnificent facility, and we love doing these spotlights here. One thing that's been in the news a lot lately is health care, and certainly the president has had his fight with the Republicans on it at a national level. I know you have been doing a lot of work on health care to try to make it more affordable for businesses and citizens in Rhode Island. Tell us how you're doing that, and where does the legislation stand?
Well, I've been working with a coalition that actually came out of what the Lieutenant Governor has been doing. A couple of years ago, she had presentations on healthcare and all the different aspects of healthcare. And what came out of that is called Health Right. And it's a coalition of healthcare providers, doctors, union laborers, administrators from hospitals, legislators, and we're putting together a comprehensive health care bill. It's in its early stages right now. I have introduced it, and what we're doing is to get attention for the bill so we can discuss it, so we can bring this out. I mean, we all know that we need health care reform. We know that health care premiums are out of sight. As a business person myself, over the years, my premiums for my employees are skyrocketed. Something has to be done, and it has to be a partnership. It has to be a partnership with the government, with employers, with employees, and that's what we're attempting to do, to bring costs in control, to monitor the costs, to have the best practices that'll keep the costs low, and so healthcare is accessible, reasonably priced, and available for everybody.
You know, and I think too, we need to take a look at healthcare providers and insurance companies, because they have very sophisticated bookkeeping, and they have ways that they can put money into accounts for future claims, and it can be very confusing to the average person, to the average home, or the average business person. And as you said, you're a business person. You need health insurance for yourself and for family members and your colleagues and coworkers at your business. Something's got to be done, because if we continue on in this direction, fewer and fewer people will have coverage.
Oh, absolutely. I mean, I think the average price of a family coverage right now is somewhere like $12,000, $13,000, and with increases of health care costs going up 10%, 20%, 30%, soon it's just going to be unaffordable, and nobody's going to be able to have it.
Now, speaking of healthcare too, I know you're working on something to rename the Department of Mental Health. Tell us about that, and why do you want it renamed?
I was approached by a constituent of mine who's president of a group called Helping Others Promote Equality. It's for disabled, developmental disabilities, people with disabilities. And they approached me, and I guess they've been working on this a while, but there had been no legislation to take out the word retardation from mental health and retardation in hospitals. And we all know how some words just over time become insulting, how they become negative.
Hugely negative connotation.
Exactly. So, you know, it was time for that to happen. I had put in the bill last year. We had a hearing on it. I talked with the department, Craig Stedding, the department head, and we came up with a name. We're going to have another hearing, as a matter of fact, on Wednesday the 10th, and the public is invited to come and talk about that, so we can finally get this done and come up with a name that's agreeable.
Well, are you close? Do you have something in mind?
The name was Department of Behavioral Health Care, Developmental Disabilities in Hospitals.
You know, I think, again, who would argue that? I mean, again, it demonstrates sensitivity, yet clearly communicates what the organization does.
Right, exactly.
You know, you only have to be this tall. I never had the good fortune of going to Rocky Point. However, I know you've also worked or are working on something to preserve some open space in Warwick. Either is it on the Rocky Point property or adjoining it or something? Tell our viewers about that.
I think anybody who's a Rhode Islander is over 20 years old, I know, knows about Rocky Point and has their own stories and excitement about it. But actually, John Howell, who's the owner of the Beacon Communications in Warwick, has helped start a foundation called the Rocky Point Foundation to get public interest and to get maybe some public funds so we can save Rocky Point to be a public open space and accessible to the public. And I think there's a lot of excitement. They just had a press conference in January, so it's new, it's young, but anybody that is interested in helping save Rocky Point,
Sure.
just go to the website, getthepoint.org.
Getthepoint.org. I like that.
Getthepoint.org, and help save Rocky Point for the thousands of us for over the 100 years and more that enjoyed Rocky Point.
The thousands of people and the millions of memories.
Oh, absolutely.
Representative Ferri, good luck to you with that. That should be a lot of fun, and I wish you and everyone in the Rhode Island House the very best for the remainder of session.
Thank you, Dave. Thank you very much.
And thanks to you for watching. You've been watching Capitol Spotlight. I'm your host, Dave Barber.